Good morning, Eden Prairie. I'm Mike Allen, co-founder of Axios. Excited to be here for the first Axios Live event of 2026. We're here with our friends from Axios Twin Cities to talk with some of the leading voices about what's next for healthcare in Minnesota and in America. We thank our hosts and partners, United Health Group. I've gotten to spend a lot of time behind the scenes with their executives in the recent years and months, and they're anxious to serve Americans in the vital human area of healthcare. And today we're going to be diving into the vital area of the future of healthcare in Minnesota, a state where healthcare policy, innovation, and industry are all moving fast. We're thinking of today as a little bit of a launch party for America's health rankings. You saw this morning in Axios Twin Cities and in my newsletter, Axios AM. Fascinating data for policymakers and others in all 50 states plus DC about what's working and what the challenges are. So we're going to go deep on that today. We're excited about that. Online, you can get 2-page report cards for every state. And today we want our audience, thank you here and around the world, and key policymakers to walk away knowing about more about the state of health in the U.S. and in Minnesota, and the work that the United Health Foundation does in providing this longest-running state-by-state analysis of our nation's health. If you don't already get Axios Twin Cities, we'd love for you to join the breakfast table at Axios.com. Our leadoff batter, Minnesota House Speaker Lisa Demuth. She's a lifelong resident of Minnesota. She's a conservative Republican, a school board member before she was elected to the House, vaulted up the leadership ranks. In February, she made history as the first Black lawmaker and first Republican woman to serve as Speaker of the Minnesota House. Now she's running for governor in a newly exciting race. The pride of Cold Spring, Minnesota. Speaker Demuth, welcome to Axios. Speaker, thank you so much for joining us.
Thank you very much.
We so appreciate it.
Thank you.
You've long been a champion of rural access to healthcare, including EMS and including hospitals. We're going to go deep on your views about healthcare, including as a small business owner. But Axios always starts with the news. Tragedy in Minnesota yesterday. A woman in a Honda Pilot killed by an ICE agent in South Minneapolis. Thousands in our community have attended vigils and protests. Now, Speaker, yesterday you posted a statement and you said, as the investigation continues, I urge everyone to reject inflammatory rhetoric and escalation. And it seems like that happened. It looked like, I just talked to Tori, Nick, the team. It sounds like that overnight was peaceful.
Yes.
How do you feel like your fellow Minnesotans have been responding to this tragedy?
I think as that investigation continues forward, and any loss of life is tragic, and I acknowledge that, but as the investigation moves forward, it's important if people want to protest that it's done peacefully, and you're exactly right, Mike. That's what we saw through the night, and that is my hope for Minnesota. We have long had the challenges as we experienced in 2020, and that when things get out of hand, it's damaging for our communities, and we all recognize that. People can use their First Amendment rights. They can protest peacefully, but we also need to let the law enforcement do their work as they're both investigating and the work that's going on by agents on the ground.
And what role can you and the Republican caucus play in de-escalating rhetoric?
I think not just the Republican caucus, but specifically for myself, the way that I have conducted myself as a legislator, as a former school board member, and just as a person in general, a part of Minnesota, I think our rhetoric and the way we talk matters very much. And so if we can de-escalate by the words we choose to use and the actions we choose to take, it will be an excellent example for what Minnesota needs.
And last question on this, have you talked to the governor since this tragedy?
I have not had an opportunity to talk with the governor yet.
And what will your message for him be when you do?
I am willing to work with him in all ways, again, de-escalating things, allowing the process to take place, but then also to make sure that people can express their rights in a peaceful way, and that is my hope for Minnesota.
Speaker, among your many gavels, you're a small business owner, a commercial property business, and so you feel healthcare up close. As costs escalate, what's the role that the legislature can do in helping fellow entrepreneurs, to both of us?
Absolutely. So small business owners in Minnesota, specifically, I speak as one of them. Our family is involved in a little bit larger business. And as we've watched prices increase, I think the legislature's role is to partner and to look at different data as it comes forward and how can we contain costs, but make sure that people, Minnesotans in general, have access and the health care that they so desperately need.
And what can businesses, startups, entrepreneurs, what can they do to help provide a better life for the people who are building with them?
Business owners and supervisors, everyone within those roles can both lead by example of a healthy lifestyle, but also make those opportunities available for their employees to get both the health care that they need, but to encourage a healthy lifestyle. You know, I have to smile because, a growing family and as people are affording and living their lives, sometimes people talk about that work-life balance. I don't know if that is ever really found because you are 100% work and you're 100% life and it all needs to mesh. But having employers that want to do the right thing for their employees is the best way to lead.
Speaker, something that aged well, as the kids say, you put on the website of your campaign for governor, you had 6 priorities, and one of them was ending a culture of fraud and corruption. And Tori Van Oot pointed out to me that there's a real nexus between public health and fraud. How do you see that? How do you look at that issue, and what can be done about fraud that hurts public health?
So fraud, specifically in Minnesota, is something that we've been talking about, and we've known that it exists for a number of years. It's really taken a spotlight right now. But when I look at the work that is being done here, a tour that I just experienced, there is a way to use data and AI, the analytics that come forward to help not just keep costs down overall, but yet we can also make sure that dollars aren't going out in fraud. There's definitely a way that we can put in fraud prevention measures using those tools available to keep the costs down.
Now, in our unveiling party here for America's Health rankings in Axios AM today, and on Axios.com, we did the top 5 healthiest states, the least healthy states, a map where you can see every one of your states. But you and I were chatting backstage with Terry Clark, one of our hosts, and he pointed out that one of the really pieces of good news data points in here is cancer screenings, up 16% from 2022 to 2024. You've shared that you're a 16-year cancer survivor. What does that stat tell you, and what can keep that momentum going?
I think cancer screenings matter very, very much, and people need access to the screenings. As you mentioned, I am a 16-year breast cancer survivor, and it was early detection that made all the difference in the world. I was a very young cancer survivor, now that I'm past that, but it was screening that took care of that. So to see that cancer screenings in Minnesota are up, that is an excellent sign for the people of our state.
Another very encouraging sign, premature deaths are down, but people who are living with chronic conditions, and of course that's a big driver both of cost and of pain, like that continues to be up. As you travel the state and now in your statewide role, both with your gavel and as a candidate, like what are you hearing that encourages you as far as Minnesotans' health, and what worries you?
We have a great state here in Minnesota, but we are vastly different. We have concentrations of population in certain areas, but when you get into greater Minnesota or the more rural areas, one of the things that is really important is to make sure that everyone has access to health care that they need. That includes regular checkups, screenings, even dental is something that we need access to make it so people can access the care needed in an easy way, whether it's transportation that might be a barrier or the availability of open appointments, whatever that might be. That's really what I hear, though, is people need that access across the state in an easy manner.
One worrisome backdrop to this data is this could wind up being a high watermark of Americans having health care, having vaccinations. Like a lot of that is going to be at the doorstep of Republicans. How will you handle those conversations?
Those conversations are continually ongoing, and we lean on leaders, we lean on professionals and experts in the area of healthcare, and then we work in the legislature, both House and Senate, with our committees to really view the data to see how we can keep costs down, but yet provide the care that Minnesotans so need. And so it's an all-in approach.
Okay, you are usually very specific. You just got very vague.
Yes.
So I'm gonna push you on this. Sure. Like, what's a way that you think is feasible that you could cut costs and therefore maybe make more coverage available?
Using AI and the data that is provided, as we heard earlier today, to look at what specific measures and what specific treatments might help keep the cost down overall.
Now, Minnesota is a very healthy state. You're 6, that's maybe down a couple, but top 6 out of 51. What do you think accounts for that? And I mentioned at the top, you're a lifelong Minnesotan. All 4 of your kids still live here. What makes Minnesota so healthy?
So Minnesota,
and what can the South learn from it?
Well, I think we are very resilient as a state. I mean, when it gets cold, I don't know what the temperature is today. I think it's around 30. That is not cold in Minnesota. We can still get out and we can enjoy our lives, whether it's walking or I'm not a runner. I have done 2 5Ks, but I never hit that runner's high. But to get out and walk or to bike.
But you're a big Orange Theory person.
I do really like Orange Theory. It's accountability. It pushes me harder than I want to. I like the rower. I do like the rower. Competitive. But I think in Minnesota, we have a healthy lifestyle. We do have access overall, generally, we overall have access to good, healthy food. We are connected in communities. All of that leans into a healthy lifestyle. Our communities matter very much to us.
I mentioned at the top that you've been talking a lot about fraud. Our penultimate question here, going to pull back the camera from healthcare and talk about fraud and government programs more generally. And the people in this audience, like the people in this building, know that there's nothing new about this story from Minnesota. Axios Twin Cities has been covering it for years. There have been indictments. The New York Times has covered it. But a viral YouTube has brought in more attention to it. Why was it that Nick Shirley was able to find things that the government wasn't?
Axios has done a great job in working with Tory, other things that have been reported on fraud. That has gone on for years. There have been different reports. As far as why did that gain the attention that it did, it's always interesting to watch social media and to see how things become viral so quickly. I'm not that expert. I don't know why it got as big as it did, but...
Well, I do, because it was vivid, it was real, it was a human telling a story. Like that's the magic of social media, right?
It really is. And there were clips that people could see, and then if they wanted, they could go on and watch an over 40-minute video, and it appears that many, many thousands of people did that. But it's important.
Millions.
Millions, yes. It's important to recognize, though, that that information was not new. It just needed to get out in a broader sense. This is an opportunity that we have as Minnesotans to end fraud immediately. Still trying to provide the services that are so needed by Minnesotans, because any dollars that go out in fraud means the ones that need it the most don't get it. That is your tax dollars, our tax dollars, federal, state. It needs to end. And this has brought an awareness now as legislators. We can come together. We go back February 17th. We can come together and make a difference and put in additional safeguards to prevent this.
And so do you think that the virality of this video, the new public attention to this issue, do you think that that's more likely to spur action in the coming session?
I do believe that it will spur that action. Now, the way we work with each other is going to be the interesting piece, because fraud shouldn't be just a Democrat or Republican issue. It should be lawmakers, leaders in the state coming together to prevent that. Some work was done last year, but much more work needs to be done this session.
Speaker, my last question for you. You're running for governor as a Republican. It looks like you now may be facing Senator Amy Klobuchar on the Democratic side. what would a Dameth-Klobuchar race look like?
I think regardless of who the Democrats choose to put in, now that we know that Governor Walz has stepped out of the race, whoever that is, I'm going to run the same race.
You're doing that thing. Don't do that thing. So you know Senator Klobuchar. What would it be like to run against her?
I don't know. I've never run against Senator Klobuchar, but I will say that I will run a clean, respectful race, and that's what I expect of any opponent. Politics, the way that I've always looked at it is when I became a legislator, I went back to my district and I said, you know what? Not all of you voted for me, but I'm 100% your representative. That is how I've looked at my public service, whether it was school board or the legislature. A candidacy and running for an office doesn't have to get mean.
I love that, and that's a great X. We used to say a tweet. That's a great X post. And Speaker, on the Republican side, another one of the candidates, Mike Lindell, the pillow guy. What do you have over the pillow guy?
A different pillow. I have elected official experience. I've been serving in the legislature, in the tie this year in the House for only the second time in Minnesota history. As a leader, I have proven that I could work for the betterment of Minnesota with Democrats in leadership too.
And Axios always ends with one fun thing. You have 7 grandkids in the state. As if that is not enough of an extreme sport, you have been sledding.
I was, yes. I have a granddaughter that said, hey, let's go sledding. And I just didn't want to break anything, and I didn't. I did it. So
drop the mic. Speaker Dameth, thank you for a great conversation.
Thank you very much.
Appreciate it so much.
Thank you.
Next up, Tori Van Oot, just back from her home state of Vermont. Speaker, thank you. That was great. Appreciate it.
Hello, everybody. Thank you to Mike and Speaker Dameth for that great conversation. I'm Tori Van Oot. I'm one of the reporters here on the Axios Twin Cities team, and we're so glad you're here. Before we get started with our next segment, just a quick plug. If you don't already subscribe to Axios Twin Cities, please do so. Put it in Google. Up next, I'm excited to welcome our next guest. Please join me in welcoming to the stage Minnesota State Senate Majority Leader Erin Murphy. Good morning, Leader Murphy.
Good morning.
Thank you.
Good morning.
So, the music. We have a lot to talk about and a lot of news and some very serious and somber news, but here at Axios, we're always focused on what matters, why it matters, and we know one thing that really matters is family. And I understand that you have some exciting news, that you have a new grandchild, your first grandchild, and there is a little bit of a connection with policy.
There you go.
Public policy here.
We do have a new grandchild, our first. His name is Ellis. He doesn't live too far from here.
Yeah?
My daughter would be cringing right now.
Everything's under control.
Yeah?
Yeah, and paid family medical leave is launching in the state of Minnesota, and my daughter and her son are able to take advantage of that. And as a result, they will be home until the end of March, caring for their new baby, which is much different than what I experienced when my husband went back to work after just 3 days because he was self-employed. So, a number of months is much better than 3 days for parenting.
All right, well, I'm glad you're getting some newborn snuggles in when you're not dealing with the political struggles out there. So we'll start with the news of the day, as Mike and Speaker Dameth did. Yesterday you called this shooting by ICE a predictable outcome, following what you described as a weak president sending ICE agents to Minnesota to sow chaos without regard for human life. And you called on ICE to leave. What's your message to Minnesotans this morning, 24 hours later? And what's your reaction to hearing Speaker Dameth talk about the need to de-escalate rhetoric around ICE?
I really appreciate the question. I witnessed and gave a lot of consideration to what we experienced yesterday in Minnesota. I did go to a vigil and ended my evening last night in a church with Minnesotans, which was the right place for me, given what we've experienced. I am a registered nurse. Prevention is always the watch for me, which is why I think I shouldn't be here. I don't know that 2,000 agents, and apparently they were at the Trader Joe's in the district I represent this morning, are serving the people of Minnesota. But it is causing a lot of chaos and now the loss of life. And so we will spend a lot of time, I think, litigating what happened on Portland Avenue yesterday. But I think if ICE weren't doing what they were doing, that loss of life wouldn't have occurred. And that's where I would make the change and would call on the president and that administration to take a different tack because we can manage things here in Minnesota just fine without ICE agents.
You said in your statement that there needs to be accountability. Should that include local and state prosecutors attempting to seek criminal charges against the agent, even if there's some barriers to doing that with federal agents with their work? But
I learned this morning that the agreement that had been reached yesterday, that there would be a joint investigation between the FBI and the BCA here in Minnesota, was changed, and that the BCA has been uninvited to participate in the investigation, which is unfortunate, because I think in moments like this, where we are looking at a video and seeing it from two different perspectives, it is useful to have trusted voices and perhaps divergent voices taking a look at that. So I am worried about that decision that got made. I think it was made by the FBI or the U.S. Attorney. And I think Minnesotans are going to be very, very interested in following along, and they do, as we all do, want accountability for innocent loss of life.
Speaker Demuth talked about her role or her party's role in de-escalating the rhetoric, keeping things calm. What are Democrats? What's the Democrats' role? What's your role?
I have to say, this has been something very front and center for me since the assassinations on June 14th. And we continue to see not the rhetoric that is driving escalation, but actions that are driving escalation. And this is the third, in just a very short amount of time, really unfortunate, horrific shooting between the assassination and attempted assassinations in June, the Annunciation shooting, kids in church, and now a bystander in a car being killed by federal agents. It's a lot for us to bear. And I was grateful to hear the governor call so clearly, and the mayor yesterday, for peaceful protest, and that is our right, absolutely, and we should bring our voices, and it should be peaceful. But I think it's going to take more for us as policymakers to just mind our words. I think we have to mind our actions. And when we engage in efforts that bring harm, that is something we have to check one another on, right? And it can't be just me being nice to the other people across the aisle. I am nice. And we should be able to litigate our differences. And we have differences, and I see at least one of my fellow members, Tony Albright, right in front of me over here. And we always had a good working relationship, even in our disagreements on healthcare, and we had them. But I think the real challenge for all of us in America is to recognize our form of government depends on different voices in finding a path forward. We've got to rely on some central truth, and we have to trust that we can talk with one another without annihilating with one another with our words and our actions. And I think we've gone far from that right now, and hope that we can find our way back.
Let's zoom out to public health, the reason we were originally supposed to be here today. There's a report looking at through a number of lenses. In Minnesota, number 6, not bad, but maybe not what Minnesota exceptionalists out there would hope, looking for number 1. So as you mentioned, you're a nurse, and I'm wondering what your kind of clinical assessment is of the state of public health in Minnesota and what you would prescribe to make it even stronger.
I am not, you know this now, I'm a grandma, so I've been at this for a while. And before I served in public office, I was practicing nursing and then worked for the Nurses Association. Almost all of my adult career has had a finger on the ways in which we have built our healthcare system in Minnesota, starting with Minnesota Care. Lois Quam of United Health was the chair of the Healthcare Access Commission that launched Minnesota Care back in 1990, 91, 92. Core to public health and the health of people is access to coverage. And we are watching now a Congress with this president really undoing decades worth of work to make sure people have access to coverage, whether it is Medicaid or medical assistance as we call it here. And people think about that as insurance for people. I think about it as payment to providers who are providing care. And it is the providers and the system itself that are going to come apart because we are seeing such a loss of funding over the next decade to our healthcare system. The same thing is true for the individual market and the subsidies that I think they're going to try and take another vote on today in Congress. They should fund those subsidies. It's keeping people who are at the upper end of a subsidy in healthcare, so people who are likely self-employed, entrepreneurs, et cetera, that creative part of our economy, they're going to lose their access to and pay way more for the healthcare. And we know, as a result, that people are they're going to step away from their coverage. And the more that people step away from their coverage, the more the costs go up, not down. So it is always confusing for people. We think, we'll take away the cost of the healthcare here in the state of Minnesota. We'll give people some money. I think they're talking about money into health savings accounts. If you're diagnosed with cancer, a chunk of money in your health savings account is not going to be the answer. I ran for office because I took care of my mom at the end of her life. She had a really awful cancer. We had to fight, of course, like so many people do with the insurance company, because they wanted to deny her care because she was dying, and she was. And gratefully, we had a provider who said, yeah, we'll fight with you, and we got her what she needed. But it really made me angry. And I think we're going to have more, not less, people dealing with that. And the foundation for a healthy population. And we'll talk about primary care, and we should invest in primary care, and we should talk about a food pyramid that serves people and vaccines. All those public health interventions are really critical, and they're all being tugged at right now. But we're not going to have a healthy population if you can't get to your healthcare provider, your primary care provider, a specialty if you're sick, and a hospital when you need it.
I want to talk about the primary care because that was one of Minnesota's areas of improvement. But when you mentioned accessibility, affordability, some of the changes coming out of Washington, this is something your caucus has been talking about this whole year. You have a hearing just later today on this topic on federal impacts. But what is the state legislature going to do? What can and will your caucus do to improve healthcare costs for the individuals? And we know this is also a big issue that is driving the state's structural deficit, the projected increases in healthcare costs, largely primary care and people being sick and doctor's appointments on the Medicaid front. So tell us what we can expect to hear from you on what policy you can actually do this year.
I have always been a participant in and a believer in the innovation that comes out of the good minds of the people of Minnesota, and I believe it because I've seen generations of it occur. I don't know that we have faced as difficult a challenge as we face right now because of actions that were taken in Washington. I'm worried about that. And, if I had a magic wand, which I don't, but I have a platform, I would tell Congress to go back and undo the harm that they are doing to the people of Minnesota. They should fix what they have done when it comes to Medicaid and those subsidies. They should. Without that, I will predict, you'll see it in the out years, a growing deficit in healthcare, and healthcare costs are going to go up. And we're going to have to figure out with less funding, because a lot of the tax dollars that we pay to the federal government, and we are a net contributor to the federal government, those dollars come back to us in things like medical assistance, in a variety of ways that support our healthcare system. They're going into the pockets of the wealthy now. So we're going to have fewer dollars and a big job to do. So I say yes to our creativity, yes to finding a way, but it's a real challenge for us. And for those of you here who are healthcare wonks or reformers, we're going to need your help. I have a lot of experience, but I alone and the legislature alone is not going to solve this problem. It is a Minnesota problem. We're seeing the phrase, especially in Greater Minnesota, which was interesting to hear the speaker talk about Greater Minnesota, because they're the ones, I think, who are seeing a lack of access most acutely right now. We have a really, really big job in front of us. We're going to need everyone's help.
And you've been a supporter of the public option, but you told reporters in November that's not something you don't see that as feasible right now, everything from the political dynamics and federal approval at this time. Bigger architectural changes.
We'll need bigger changes than that.
Let's talk a little bit about fraud, which, as Mike noted, does have a nexus to public health in terms of the types of programs that have been targeted. You heard Speaker Demuth talk about the childcare, the viral video. You muttered under your breath, banana pants. as they were talking about the video. Tell me why you said that.
I watched that video. I watched what happened. I was shocked by it. Going back to, again, the experience that we had in June, and the virility of things like that. So we had a young person with a camera going to the doors of child care centers and demanding, where are the children here? As a result of that, child care centers locked down. So we got little kids, infants and toddlers in lockdown child care centers with police outside. Parents are likely losing their funding, working parents, so they're going to have to choose between their jobs. Child care is already really scarce. Choose their job versus their kids. They're going to have to figure that out. And when I learned that, it was the GOP operatives, perhaps the speaker herself, who invited Mr. Shirley in to the state of Minnesota to do that, to make a point. I thought there are better ways to make a point than to put people at risk like that. That's why I said banana pants.
So I think a lot of people, though, who watch that video alleging the fraud are asking themselves, why can't the state do the legwork? Why can't the state do this? They have sometimes why journalists can't do a reality check. We have been investigating. But why can't the state go and look at these providers and see if they're legit? We think the fraud may touch as many as 14 programs at this point. There's an audit underway. Are there enough state inspectors to go into daycares, other care settings, and ensure that services billed are actually being provided?
I think there should be more site visits. I think that's something that this administration is now pursuing and putting into place. But I think it's also important to say this, right? When we think about government, one of the ongoing pressures is, what is the size of the government? Should we spend more money? The Democrats were in charge. We've been in charge for the last 3 years in the Minnesota Senate, and we're going to get accused of spending too much money. If we don't invest in things like inspectors and technology in the bureaucracy, those things don't happen. And as I look back, there are program design issues. When we think about especially those 14 programs, they've been passed by Democratic majorities, Republican majorities. There are some design issues there that we should take care of as a legislature. The Senate majority has done a number of things over the last 3 years. I always like to say, if you Google Senate DFL and fraud, you will see a long list of things that we have already done to strengthen and reform to make sure that we are preventing fraud. We have more of that to do. I would rather do that than dial up an influencer and have them come and do an expose in the state of Minnesota. More boring. I am less sexy and all of that, but I'm a policymaker and I'd like to get my job done, and we've taken it very seriously, and we will continue.
Leader Murphy, unfortunately, we're out of time, but I'll ask you real quick for one kind of fun thing. You're somebody who embraces joy, and we've had a very difficult year, plus in Minnesota here. How do you find joy or that spark even in dark times?
I got a note from somebody this morning reminding me that I embrace joy, and I do. It is because I love people. It is painful when we are in a painful place, and we are right now. I was really hoping 2026 was going to start off on better footing than what we'd left 2025. I'm wrong about that. And we have to persevere through that. When it is really hard, I pet my dog. We have a dog who's about 1.5 years old, Winnie, godsend, and I love to be outside, and I love to be with people. And that is where I find my happiness and my joy. But there is joy in a purposeful fight, and we have one in front of us, and just know that I'm here until the people of the Mighty 64 kick me out, or I decide there's something better to do. We have something that works in the state of Minnesota. Our democracy still works in the state of Minnesota. So I hope you will leave with some joy and some faith in what we can do together. Thank you so much for having me.
Thank you. Thank you, Leader Murphy. Thank you. Up next, I'm going to pass it over to Axios publisher Nick Johnston.
Good morning, everyone. I'm Nicholas Johnson. I'm the publisher. Oh, I even get the applause, too. Thank you so much for being here. Almost 5 years ago, Axios Twin Cities was one of the first of our investments in local journalism. And so if you signed up 5 years ago, thank you. If you haven't signed up yet, it's not too late. I encourage you to check out our awesome journalism. And of course, thank you for being here
today. And nothing we do at Axios would be possible without the support of our partners. The investments we've made in local journalism here in the Twin Cities and around the country, convening great conversations like this, only thanks to the support of our partners. So huge thanks to United Health Group for making today's conversation possible. And I'm very excited to welcome for a View from the Top conversation, United Health Group's Executive Vice President and Chief Medical Officer, Dr. Margaret Mary Wilson. Dr. Wilson, welcome to the Axios stage. Good morning.
Good morning.
Let's start big picture. Why don't you tell us a little bit about your background and your role?
So first of all, thank you for having me, Nick. I currently serve as Chief Medical Officer for United Health Group, and before this role, I was the Chief Medical Officer for United Healthcare Global. So by way of background, I'm an internist and a geriatrician. I spent the first half of my career at the bedside looking after patients, teaching medical students and residents, and engaged in clinical research. I've also had the opportunity to travel and work across countries. So Nigeria, the country of my birth, worked in the UK and in the US. And I think that actually drove my passion for healthcare systems and has given me interesting perspectives to the differences in healthcare systems and the challenges.
So let's dig in on today's news. As Mike mentioned earlier at the top of the event, the release of America's Health Rankings, the annual report came out today. Zoom out a little bit to start to tell us what it is and what it hopes to achieve.
So the easiest way to think about America's Health Rankings is it gives a snapshot of the state of America's health. Best description I've heard is, think of it as America's annual wellness visit. Right? It started in 1990. So it's really the longest running analysis of its kind. It pulls from about 30 odd data resources, masses of healthcare data, splices that across demographics, age, education, income, geography. I think the intent of it, and it gives not just the national look, but also talks about state trends and nuances, regional nuances. And the intent really is to provide policymakers, public health officials, all stakeholders interested in public health, the line of sight into, actionable data and thinking through the opportunity to understand how the masses of data influences variation in healthcare trends across our and within our
You've teased the two things I want to get at about the data and how to action on it. But first, I want to dig in on something you just mentioned, like it started in 1990. So you have 36 years of data. As a medical doctor, like how important and valuable is that kind of trend information?
Very valuable. I mean, as I mentioned earlier, I was significantly involved in clinical research, and the one thing any researcher will tell you is that there's masses of healthcare data out there, and it can feel overwhelming pretty quickly. So lots of value in the 36-year time frame, because it's one of the few reports that allows us to actually view those long-term trends with the same sort of approach, the same data set.
Like it gives you a sense of perspective, I guess, instead of those moments in time.
Correct.
Well, let's dig in. Like, what are the key findings from this year?
So, encouraging. Many of them are encouraging. I've already heard one of the previous speakers talk about the reduction in premature deaths. That has gone down by 8%. The reduction in drug deaths has gone down by 3%. Very encouraging is what we're seeing in cancer health screenings. So that's increased by 15%. And the increase is seen across 47 states and DC as it relates to colorectal and breast cancer screenings. The third, tying back to your 30-year question, is what we've seen in mental health providers. If you look at the data from 2018 to 2025, there's actually been a 57% increase in the number of mental health providers. What we're also seeing in the mental health space, the rates of depression, rates of frequent mental distress have not changed. So they appear to be stabilized, which is relatively good news. A significant opportunity, though, that the data reveals is the increasing rates of multiple chronic conditions, and that is 3 or more chronic conditions within the same individual. And we're seeing that increase more in the age group between 18 and 44.
Right.
So there's a 17% increase there. When you go to the next age range, 44 to 65, it's 12%, And over 65, it's actually the lowest rate of increase, which is 5%.
So it sounds like there's a little bit of a good news, a little bit of a bad news element here. Let's do those in order. What are the lessons we take away from the good news?
I think the lessons that and you know, good and bad is probably not the way I would characterize it.
All right.
There is
I'll give you a chance to characterize
There
it.
is encouraging news, and there is news that allows us to identify opportunities that we can act
Got it.
on.
Okay, so what's behind the encouraging news?
The encouraging news is really speaks to the fact that the way we view it, our approach, our collective approach to healthcare is working. It's encouraging because healthcare models are increasingly more focused on the person at the center. They're increasingly more focused on value-based care. So these data are actually saying to us this approach appears to be impacting. Right. The opportunities are saying to us there's more to be done. And really it's about leaning into preventive care. Not simply preventing the emergence of disease, but preventing existing disease from getting worse. And that, again, all ties into the patient-centered, value-based piece. So that's preventive.
It sounds like continuing to push forward on that whole of patient care, because there are a lot of these inputs that would lead to the negative
Correct.
outcome.
And I think the other interesting thing that we're seeing from the data is that we need to really focus on rural and remote healthcare. Because even with the encouraging data, it's the improvement. There's still that improvement differential between rural and metropolitan.
I mean, that was something the House Speaker said earlier, a focus of hers. Well, let's flip this a little bit into homework. Like for folks in the room, for post-watching online, for policymakers, healthcare professionals, how can they be a force for good? How can they help? What should they look for in this data, and how can they use it to keep these encouraging trends continuing?
I mean, I would say the first thing is actually using the data, right? Leveraging it, pulling through the actionable insights, and really allowing those insights to guide the nature, the focus of our interventions. So that's the first thing, it's the approach. And then I think about the areas which we mentioned before. I really think it's about really leaning in to preventive care. I think this is where value-based care models that drive that and the importance of care coordination come in, and really focusing on
finding ways to get to that problem before it becomes something chronic, something acute.
Correct.
Before we get the hook here, as everyone knows at Axios, we live on one fun thing. My favorite part about interviewing doctors is they always have great stories. So one fun thing, what's one fun story from your time in dealing with patients?
I think the story that takes the cake is what I call the pizza party. So I was, see, I got a laugh even before I started.
It's already a good story.
So picture this, geriatric clinic. I have a geriatric clinic that afternoon. It's a specialty clinic, so it's a small panel. I'm expecting about 6 patients. So I walk into the waiting room, and there are 8 patients. I know all my patients, right? I recognize 2 ladies because I'd seen them the previous week. And I say, well, Miss X, do you have an appointment? She's like, no. But we knew our friends had appointments. And I'm like, your friends? Yeah, we all became friends in the waiting room. Okay, so we decided we would come hang out with our friends. And she says, face it, Dr. Wilson, because at this point I noticed there's pizza all over the place and there's actually music playing. And Miss X says, and face it, Dr. Wilson, your waiting room is boring. We've read these magazines 100 times, so we thought we'd liven it up. But the best part, Nick, she said, and we kept a piece of pizza for you.
This seems like a very good example of whole of patient care, right. It sounds like. That's an awesome conversation. Dr. Wilson, thank you so much for being here today. Huge thanks to United Health Group for making today's conversation possible. And I'm going to bring my colleague Mike Allen back up on stage for a big finish.
Thank you so much, Nick. Thank you for having me. Thank you.
And now, the big finish. I'm going to be joined by my Axios Twin Cities colleague, Kyle Stokes, who has a great party trick that he stole from your former Senator, Al Franken. Some of you know what that party trick is. He can draw every state, complete with the lines, from memory, perfectly, freehand. Kyle Stokes, come on down.
Thank you.
Thank you for your great coverage. Tough
Thank you very
time.
much.
So this Why It Matters segment wraps it up. And one of the takeaways, we were just chatting backstage with Tori, one of the takeaways from these conversations is that even though these are big opportunities, as we just learned, a lot of encouraging signs that a lot can be done by state policymakers, a lot can be done on the state level, and that's why our readers love data, like they loved America's health rankings, and policymakers should really dig into this, really pay attention to it. On the healthcare side, like they wait eagerly for this data, but there's a lot that policymakers across the board can learn.
Yeah, I mean, and I think we're in a state that ranks highly, so top 6 finish, that's a little bit of a dip, but it still is there's a lot of good news in this report. There's something like 50 areas in the report. Minnesota ranks in the top 10 in about half of them. I believe we're top 5 in 7 of those. One of the things that actually stood out, because Speaker Demuth brought up Orange Theory, I was actually surprised to see that Minnesota leapt. It was apparently the biggest leap in the nation in the drop in physical inactivity. We went from 19th to 5th in having the fewest inactive people, which I thought was interesting because I feel like we're from Minnesota. Like, people go out and they run in the summer. They cross country ski in the winter. I always thought that was part of our identity. You can go through all of it. We're apparently number 1 in sleep. We get the most sleep here in Minnesota. So lots of good news, including things like premature deaths, where we rank 6th. But then click into that a little bit. And I think that as a reporter, I cover a lot of the kind of to Minnesota's reality, that if you have money and privilege and access to resources, but the premature death racial disparity category, we dropped to 48th in that category. And if you look at that, and what that represents, it mirrors a lot of the realities that I'm covering when I cover. Most of my day is spent covering like City Hall issues in Minneapolis and St. Paul. And the community that sees the biggest issue with premature deaths is the Native American community. And there's so much of the issues that pertain, it's ringing in my head is about homelessness in our state, centers around the Native American community. So I think that's important to note. You can look, and if you dig into any of these numbers, actually, there's a more varied, there's sort of a to Minnesota's reality there.
No, that's a great point, Kyle. And I've mentioned that you can go online, you can look at a 2-page report card for all 50 states and DC. And I was struck by how regional these trends are. So the United Health Group has isolated the 4 healthiest states, the 4 states with the most opportunity, and the 4 most encouraging states, all New England.
Yeah.
The 4 with the farthest to go, all the South.
Yeah.
And so that's diet, that's history. It just really is.
And last year we were part of that group. And there's sort of this like New England style kind of, large social safety net approach that we've talked a lot about today in the conversations with the leaders that put us in that company.
So Axios Twin Cities covered the sort of sleep culture here. What do you make of that? How do you explain that?
I can't. It's like cold winters. I think cold, you all are the healthcare experts here. Apparently cold helps you sleep. I don't know. That's my guess. So do you get enough sleep?
Never enough, but more. So
I'm getting less sleep now. I don't know. But
no, I have an Oura ring that is very good with my awareness. And it gives me a gummy crown if I get enough sleep. And so I always go for the crown. So I get up very early because I do a morning newsletter, but now I go to sleep also very early because it's interesting. Axios, a lot of you read and have helped us with Axios Finish Line, a newsletter that we do in the evenings, and it's health, wellness, life, well-being, leadership. And the 2 things that I've learned from digging into that research, and I always was pretty aware of fitness. Jim Vandehei, our Axios CEO, and I are real students of longevity. But as I dug into the research for Finish Line, 2 things that became instantly apparent. One, there's 2, you can read all kinds of things about what a cold plunge does for you. Sauna, the research is pretty clear. Supplements, very unclear. But one thing is always true. Sleep longer, live longer.
And it's carrying us up. It's carrying us up to 6.
And the
It's
other,
like just dragging us up there in those rankings.
and Ben LeBold, who's here, will be sorry to hear that the other finding from the research is, I think when we were coming up, we thought that a little booze was good. And it turns out that that's not actually.
We have too much. I think we're like 40th is where we landed on that ranking. We drink too much. Too much German heritage in the state, I think.
Kyle, as we say goodbye, as you talk with policymakers, lawmakers, other here, what can they learn from this report? What can citizens learn from it? Taking the idea of like, how can you be a force for good? How can individuals and people who have a platform make a difference on these issues?
I've always thought that on issues, to this Two Minnesotas issue, I think the issue becomes politicized, and I think some of it is just like, well, just look at the data. There's a nuanced picture here, and we have to be willing to look at all of it and the varied topography there. I have to do that as a journalist. I think that's an important part of being a policymaker and looking at this. I mean, the many dimensions of this report are sort of a great kind of crystallization of that reality that we need to look broadly at the state of our health, the state of any issue that you're really looking at, and this does a really good job of unpacking that.
Something that I thought it was great that it touched on was the importance of community and volunteerism. And we learned that loneliness does take a toll on us, and that's something else that has come through in the research is a sense of community, legitimate friendships, like all those make a real difference. It can make an actual clinical difference.
Mm-hmm. Yeah.
And
I agree.
and that's a part of that's a place where I think the culture of Minnesota shines through.
And it kind of goes to our cohesiveness. There's a lot of cohesion in the state, and we often actually joke it's sort of it can be a difficult culture for outsiders to penetrate, right? Because it's like if you want to make friends in Minnesota, go to kindergarten. But the flip side of that is that people do have these like deep connections. Someone once said to me that, it's even these connections to rural Minnesota, to greater Minnesota. Almost everyone, it's not like the divide between those two areas. I mean, there obviously is one. We see it in the data. There's also like everyone, it feels like has a connection to, the farm out in western Minnesota or your cabin in Lake Country. The bubbles that we isolate ourselves in, I think just the geography of the way that we organize ourselves here does something to kind of bust into that and create that social cohesion.
No, I think that's right. I just looked, and it is correct that volunteerism is one of the data points that is up, and it is one of the most encouraging points. So, smart brevity to finish this Why It Matters segment. Volunteer and sweep more, drink less.
Yeah.
We thank you to our hosts and partners, United Health Group, and the whole UHG team, coast to coast, that makes these fascinating conversations possible. This morning, they wanted to help us live healthier lives and make the health system work better for all of us. Thanks to the all-terrain Axios Live team, which kicked off an amazing 2026 with this event. Be sure to stick around for a networking event hosted by the United Health Group team. Thank you, Eden Prairie. See you on Axios.com. And thanks to Kyle Stokes and Axios Twin Cities.
Thank you very much.